Okay. Hello, my name is Neil, and I'll be presenting about antibiotic-driven and microbial target therapy for advanced management of pulmonary hypertension. That was a long name, but basically is trying to learn about how you can use antibiotics to help alleviate the symptom of pulmonary hypertension. And I'm going to call pulmonary hypertension as PH to be fast. So we are integrating three systems, respiratory, cardiac, and digestive. So the primary goal of the pulmonary system is for us to get oxygen. So oxygen would travel through the bronchi to bronchioli through the alveolus, and that's where we collect oxygen. Now that we collect the oxygen, we need to distribute it all across the body to give cells oxygen to do respiration, right? So that's coming the role of the heart. The role of the heart is to pump the oxygenated blood to the lung, collect oxygen, and then go back to the heart, and then eventually spread all across the body. So its goal is to spread oxygen and collect oxygen. So these two, pulmonary and cardiac, work really together. And then we have the digestive system. Its primary goal is to break down and then absorb food. And then this paper, you will get to learn how these three systems work together, and it's just really cool because digestive is just like a totally different thing and still contribute. Before I go into that one, I want to introduce COPD. It stands for chronic obstruction pulmonary disease. And for COPD patient, they have narrower of the bronchioli and then fluid mucus, so they breathe harder, so it's harder for them to breathe with mucus. And then why should you care? You should care because this is like a new class of drugs that could potentially be found. And this relate back to our class because it goes through all of the system that we cover in class. And then we also get to learn how COPD and can relate it back to the cardiac system that we already covered. So what is pH? pH is when you have the blood vessel get thickened, and when it gets thickened, it's harder to keep the blood pressure, so your heart has to pump harder to get oxygen travel all across your body. And when it gets constantly pumped harder over time, it get tired and eventually could lead to heart failure. So in summary, pH stands for your heart vessel get thickened, and that causes your heart to be exhaust. So that causes it could be idiopathic. We don't know. It just happened. It could be from genetic. It could be from medication, other disease. But the primary one that we will be going over here is you get pH from COPD. They only focus on this group of people because this group of people, they do not get a lot of drug therapies for them. The options are not a lot. So they're just looking for more option for patients who have pH from COPD. So again, the question is, can taking antibiotics alleviate the symptom of pulmonary hypertension? And the primary goal is to find more class of drugs to treat this pH. The subject they were studying on rats were rats. They were um, giving rats hypoxia, collect their tissue, and then get the data. They also collected guts, the feces, and the pharyngeal sample from humans to establish microbiome data of humans who has pH that take antibiotics without um human who take antibiotics with human who do not take antibiotics. Like they were just looking for like the base understanding and base knowledge and what bacteria could be present in the guts. So first, they measured the gut microbiome of healthy patient versus pH patient. And also, these patient, the PH patient, they were divided into two groups. The group that take antibiotics and the group who do not take antibiotics. So there were actually three groups. Control, healthy, PH patient who take antibiotics, PH patient who do not take antibiotics. And then they collect the pharyngeal sample and feces sample. And then they did 16S sequencing to look for the what bacteria to identify bacteria. So they identify bacteria through 16S sequencing. And then Again, they look if the antibiotics actually help pulmonary hypertension or not. They look for this through rats because they cannot just give human hypoxia and test it. That will be an ethical issue. So they give rats a pH rat hypoxia. They give them antibiotics or not, and then they look for the effects. And they also have to kill the rats because they have to get the lung and the small intestine tissue. And then they also measured the blood pressure only specifically on the right ventricular artery. So figure 2C, this is when we look at the patient data. So for this one, they only look at the PH patient who take antibiotic, which is in green, and who do not take antibiotics, which is in blue. And you could see there is significant level decrease. So if you take antibiotics, it will lower your blood pressure. And relating this back to physiology, you want lower blood pressure because it's not gonna cause because lower blood pressure in long term is not gonna cause your blood pressure to be thickened. And when it does not thicken, your heart don't have to overwork, and that's good. So they did the data with all of the groups, and over here they show the data of group three. Again, group three are the PH patient who has PH from secondary from COPD. And again, they want to look at these group of people because these group of people actually need this kind of drug the most because they don't have a lot of option for drugs. Over here, still in the patient data, but this time we actually look at the microbiome diversity. So over here is an overall diversity. You could see that ABX, which is the patient who take antibiotics, PH patient, and then NABX, the PH patient who do not take antibiotics, and then HC, just the control. There are big difference all across the three groups. Um, but here's the significant test. So you could see that this is per nova. So the way you read this graph is the more spread out, the more significant. And all of the groups, they all spread out all across the graph. So that means there's a significant level between the groups. And again, over here, it's just like a bar graph. This one is done in Mindwoody rank sum. And you could see there are changes in diversity. You have decrease in diversity. Obviously, you're taking antibiotics. You're selecting for certain groups of bacteria. So that's why the diversity drop. Then over here, still significant diversity drop. Moving on, so the two cool things that I found is that two of the pro-inflammatory bacteria genus, Streptococcus and Prevotella, they were reduced in the patient who take antibiotics over here, the green one. However, I cannot say a significantly decrease in Streptococcus because it's not significant here, and you you cannot just say it decrease because of I think because of the standard deviation were pretty high, so it was not significant. However, luckily for Prevotella, there's a significant level. So I could say that taking an antibiotic decrease the inflammatory bacteria, and then eventually it will deal with the immune system, and then you get less immune system, and that's better for pulmonary hypertension. Oh, so because we mentioned about inflammatory, so that also slightly mentioned the immune system. So it's just an honorary mention of the immune system. Now is when we actually look at the rats. So their control rats over here, the normal rats, the hypoxia rats, and then the rat that get the antibiotics before hypoxia treatment, and then the rat that get the antibiotic treatment during the hypoxia. And we could see that in the right ventricular systolic pressure, there's a decrease in the rat that take antibiotics. You could see that here the blood pressure decreased down. However, it's better for you to give the rat before hypoxia because you can see here if you give antibiotic before you give them hypoxia, the blood pressure is lower. So I guess, and it's significant level. And it's significant. So it's better if you give the rats before. However, for the wall thickness, So the ratio is done by wall area divided by total vascular area. And you could see that if you have the antibiotics given to the rat, um, the wall ratio drop lower. So the less ratio, the less muscle is present. And less muscle is present, that means the artery is not very small, it's wide and it's flexible, and you can retain pressure better, and that eventually leads to your heart working fine. But the more muscle, your heart had to work harder to bypass that. So it's not good. And you can see that if you get antibiotic, it's good for them. And looking at the villi, they look at villi because there are data from previous study over here, Sharma, that suggests that if you give them hypoxia, there are shortening of the villi. So that means that if the villi is longer, that means the effects is not as bad. You can see that the villi over here is super high for the control and then pretty high for the one who take antibiotics. Yeah. Overall, give them antibiotics and give them hypoxia, so it will reduce the damage. However, for if you look at the pressure, if you give them the antibiotic before let them experience hypoxia, that will allow the rat to perform slightly better in the pressure. Again, the discussion and conclusion, we talk about how antibiotics lower the blood pressure for patients in the human figure 2C. There are data in human that if you give human antibiotics, the blood pressure decrease. And then we also did with the rats, and you could see that lower blood pressure, and then the villi is longer, less damaging, and then the wall, it's the muscle ratio. There are less muscle if you give the antibiotics, so there are less damage. And these results suggest that the digestive system somewhat modified the gut system, and that allowed the cardiac and pulmonary system to perform better in the pH. And then this integrated out, it covered the three systems that we cover in class. Then we also talk about the pressure, the heart pressure, how the body has to keep it at a certain pressure. You cannot keep it too high because that will make the wall thicken and tire the heart. You cannot give it too low because that will not give enough oxygen to all of the tissue. And then critical analysis, I think this study is only surface, it's not very deep, because there wasn't really clear with replicating COPD symptoms. Also, 16S is not really accurate. I've taken bioinformatics with Dr. Balaman, and we actually criticize how 16S sequencing is not accurate because it's done not representing the entire gene content. We also talk about how antibiotics their usage that for the antibiotic usage they were not specific with what kind of antibiotics they use it, so we don't know. So what could improve? I would suggest they test more antibiotics, like establish a new research with like um, clear put antibiotics and see which one is perform better. I would also suggest that they would give the rats COPD by give them smoke, actual cigarette smoke, but it's come with the ethical issue, so I don't know. Maybe find a better way. But yeah. But again, we also have to wait in the cost of using antibiotics, which is kind of bad too, because a lot of people talk about how antibiotic could give resistant, bacterial resistant. Yeah, thank you.